We are live, tartle.co. Today is another exciting live presentation with the wonderful, great, man, you've lost a lot of weight.
The hell does that mean?
You look like a movie producer, like Michael Mann or something.
I feel like
really
one.
skinny.
I need more lens flare.
Yeah. It's like that, but with the shirt and the hat. You know, don't you look like if you had sunglasses on?
I need more lens flare.
Yeah, you would look like we have a lot of that here in New Mexico.
Doesn't matter how much I eat. Look at my body. Just
so much filming here.
Tons.
Yeah, I mean, if you look at Netflix, watch the shows, look at the landscape of New Mexico, you'll see most of the shows.
Yeah,
we even have a show called Roswell.
These are all of our shows we're going through.
Yeah, yeah.
I got them all right here. Yeah. Look at this list. I have a huge list of shows.
That's awesome. So what happens if I have a question. So you're filming in the middle of you're way out in the wilderness here in New Mexico. Sure. We have wilderness. And an elk comes by and a black bear comes by and you're seeing this beautiful. And then you have a crew of 100 people out there just filming. And then all of a sudden somebody gets hurt.
Sure.
From the
black bear?
Yeah, it could be from the black bear.
Mm-hmm.
They got gorged by an elk. Who knows?
Sure. Yeah, anything can happen.
Lots of things can happen out in nature. And they go to the hospital.
Sure.
And then certain things begin to happen data-wise at the hospital. And there's lots of parties that get involved. Insurance companies. I mean, you have what led them to come there.
Right. The choices they didn't
make. You have the emergency room.
Mm-hmm.
Data points being created there.
Devices. The devices attached to that person. Yeah.
You have
labs being run.
Yeah. You have, let's say they spend 7 days in the hospital. Lots of data points going on there.
Tons.
And then when they leave, the hospital wants to know how the care was and wants to know everything. But the insurance company needs a lot of information too.
Yeah, because they have to send a bill.
Yes. Yeah.
The bill always comes due. It's a very good comment, but it's also true. There are so many people in the medical healthcare process that are involved just for the care of one person. So if you think about it here, hospitals, also in German called a Krankenhaus, they're useful things for keeping people, actually getting people healthy after they've become sick. For a very long time, hospitals are only there as a reactive system. And these reactive systems have been collecting reactive data only after the fact when something has occurred. What's been missed are the things which you so aptly provided here in your filming example in the beautiful New Mexico wilderness, is that there's a story which people have to their life. There are determinants, very social ones, that define the narrative that actually leads people to the moment of why they actually end up in a hospital itself. Why did you get sick? What have you been eating? What life choices do you make? What is your mental state like? Do you feel depressed? What's going on?
Are you employed?
Are you employed? These are all huge things that determine really what the long-term health outcomes are going to be for you as an individual. And now these hospitals and these insurers are changing their focus. It's not just about the reactive approach. Now, what they find is that if they can identify constituent members ahead of time, really engage them, which they do a poor job of doing, and they all know that member engagement is a very difficult thing to do. And we can identify these people ahead of time before they become sick. There's a 15 to 25% decrease in multi-billion-dollar costs for running that hospital itself. If you're an insurance company, the last thing you want to do is pay out your insurance. You want to collect premiums, not lose from that. Okay, there's no benefit to it. In the hospital, albeit is great to be there, but you don't want to have more people in your hospital. That's not to your benefit.
No, yeah. It's important what you said, and I want to kind of go down this rabbit trail if we can, because I think there's two things: member engagement and member insights. So let's stick with member engagement, because I want to kind of define this. And those that are buying data and looking at, you can take whatever industry you want and correlate this, but specifically those that are in the health industry, we want you to understand this. So member engagement, like you said the problem.
Yeah.
There's poor engagement.
There's poor engagement. So let's talk about how identification and essentially building this profile of a constituent member base. You could have 15 to 40 million members. Okay. What's a really good effective means for collecting info from these people? You're going to collect it at 2 points right now. This is how member engagement occurs. When someone comes into the hospital, the doctor's going to ask them questions. Okay. This is the first point of engagement when the person's in a state of, ill health and they need help.
They may fill out a form.
And then maybe they fill out a form while they're waiting. Anything of the sort.
I've done that before.
After they've lost a finger in a construction accident. The other aspect is the hospital will collect information when someone calls in about their bill.
Mm-hmm.
You are going to ask me, when you're trying to service me something because I have to pay you, first of all, it's something I don't want to do because I became sick, right? So I wasn't planning on paying you. But you're going to call me and you're going to ask me about my sexual preferences on a billing call. Optically, how do you think that's going to be received by the member?
Mm-hmm.
And someone in the billing department is now responsible for asking people these questions about essentially their profile of who they are as a human being. How's that going to work? And then other parts, and I guess there's a third one here, is that these systems, right, these large healthcare systems or insurance systems will try to engage with the community like very physically in person. They'll try to go into lower socioeconomic or impoverished areas and, run events and try and collect information from the community. But it's albeit ineffective because it's the people that choose to show up and participate.
Right. So that's engagement.
That's engagement.
It is showing up and participating.
Correct.
That we've identified the problem.
It's a huge
problem, billions of dollars.
Mm-hmm.
It's $1 billion problem.
It's a multi-billion
dollar problem. So let me ask you this. And I would say you've studied this quite a bit. So you're an expert in this when it comes to this. How does TARTLE solve that?
I'm glad you asked.
$1 billion problem.
Yeah, I'm glad you asked. We specialize in engagement. Our engagement rates for people that participate in the TARTLE marketplace for data collection ranges anywhere from 75 to 94%. 94%. More often than not, it's in the 90s. But that range you're going to see through the participation in engaging with constituent members, 75 to 94%. Take that percentage and apply it towards the $1 billion of cost you have. Knock the 74% right out of the gate. That's $740 million in savings.
Yeah,
because your engagement is increased.
So I'm saving tons of money. I'm engaging them properly, and that's the key through incentivizing them. The optics.
Well, it's the optics. What are you doing? If you're focused, which many of these plans are in these health better systems, on health equity.
Right.
Health equity is also a function of paying people for this data sharing, making sure they're a part of the process, and doing it in a format that they're comfortable and can easily engage with. Ones that make sense. It's simple. People can't be technologically barred from this process, but almost every single one of the members that they have in these programs, they all have cell phones, and every single one of these has the ability to access the TARTLE marketplace. So a health plan comes to TARTLE, okay, some sort of medical research hospital or an insurer will say, we need better engagement. How do we do that? Well, let's talk to you about what are the gaps in your data, what's been missing, and let's design what that data capture looks like.
I love that.
And then you deliver it to your members so that your members have an ecosystem which they can plug into. That's an independent third party. And you can do a lifetime data capture.
That's awesome.
Which is the best part of this entire thing. You can not only get the things on their medical record, but you get social determinants of health. I get their Fitbit information. Heck, if I wanted it, I could ask people for their genomic sequences. And they have the choice of sharing that with me.
And this is what's so important and leads us into the next problem, and that's member insights.
Correct.
So I have all this passive aggressive information I bought third party, or maybe I've collected this, not sure how to, because that's another thing too. And I'm going to use I like to use not so much corporate language, but kind of use like real life language.
Oh, I like real life.
So I've become a hoarder of information.
That's true.
And I have it in different rooms in different black plastic bags. I can't see what's in it, but I have a lot of it.
But why?
And I can barely open the door.
It's just going to pour out on me.
Because it's going to pour out on me. But I have a ton, and I paid a lot of money for this. But I have it all.
Right.
But I have no insights into the data.
That's correct.
So how can I clean up that room, categorize everything, put the file cabinet against the wall, and walk in where I feel good about this, where I have a good feeling? Because why do I have a good feeling? Because I've ethically sourced it all.
Right. I've done the right thing.
I've done the right thing. And then at the same time, how am I gaining more insight on my members through that?
Because I'm not getting a massive nonsense. I'm going to the member and asking them about the yardstick of themselves. How do you measure this? What's your best outcome? What are your actual mental states? I'm not asking people to sign into this totally overburdened, My Chart portal.
Right.
And maybe how many people go into their My Chart portal?
Yeah.
Not that many.
No, not that many.
Really not that many. Of
Not
your
that
millions of members, no one's engaging with it. This wouldn't be a problem if people actually engage with it.
Yes.
It's as simple as that.
Mm-hmm.
And if you're talking about the member insights, ask them directly. No longer you don't have to guess. You don't have to collect metadata through the systems. You don't have to look at the health, the EHR record and determine, this is what happened in the emergency room. This is who they are. No, ask them who they are. Let's have that engagement. Let's get some true insight.
Well, the beautiful part about it too is, it's a data marketplace.
Yes.
So it's not just me creating a survey or asking questions or having them do an action. There's other things on the marketplace that I can ask that person that I could buy from.
Always.
So if I want to know, you had talked about this, but if I want to know gender studies and understand completely, I think we have a beautiful way that we do that.
It's tremendous. Multidimensional.
It's multidimensional, and I haven't seen anything like that.
It's borderline cosmic.
Yeah. It's not even really a scale. What would you call it?
No, it's fluid.
Yes. And
it
gives you so many different options to be able to understand. And it's almost like a shade. Different shades of color of where I want to be. And I can pick those shades according to how I feel.
Yeah, correct.
And that's us once again using technology to put the power back to the people.
Puts power back in their hands. It opens up the conversations. It's very equanimous.
And a healthcare company could buy this exclusive way that we do this through.
Yeah, they
TARTLE.
could. Yeah, and just remember, when you're coming in to participate, you're financially uplifting the people you're engaging with, the ones you want to have better outcomes.
Mm-hmm.
What's better than helping people pay for their next meal?
Well, this is funny right here. You have 70 something pages that you went through and studied.
Yeah.
On the data, AI and data Bill of Rights.
Correct.
The first 2 pages is all about understanding and being careful about who you're taking data from and how you're taking it.
And making sure they have actual participation.
Yes. And it being ethically
Yeah.
sourced, which is a word we use. They didn't use that word, but we're using
it. Didn't. I need
and then using diverse communities and making you understand that.
Mm-hmm.
So if this is something that you're worried about understanding, and we went through the last live episode, we went through this and talked about it, TARTLE solves all those issues.
It does.
So if you're a healthcare provider, hospital, whatever it may be, and this is something that you're approaching because you don't know what the data that you have in all those black plastic bags in that dark room, let TARTLE come in through incentivizing people, through letting the power of the people, and they will clean up that room for you.
They'll do it for you.
They'll get lights out.
It's like having millions.
It's like Habitat of Humanity. It's like building the house.
Millions of workers coming in and helping you build the house that needed to solve your problems.
Yes.
If you want a 15 to 25% cost savings because you're identifying people ahead of time and engaging in an ethical format, the members that you have, the millions of members, you do it through TARTLE. You get targeted data capture. It's an iterative process. I can always go back to those members.
Yeah.
This mechanism.
And so, especially through the things that went on with 20 and 21 and pandemic and all that.
Sure.
We got a sense of something that happened and the industry shot up a whole bunch, and that was supplements.
Oh, most definitely.
People like, oh, wow, I need to take vitamin D. I need to, make sure I take supplements and stuff like that. And I do, and I know you do, so on, whether you do it in shout out to mud water or whether you do it through with the green, juice or liquid IV I have in here. We all have some type of supplements.
Right.
So whenever we look at TARTLE as a supplement.
Nice.
You see what I'm saying?
It's
your data.
Yeah. Just as much as we're supplementing with vitamins and other nutrients, hospitals, member organizations, insurers need to be supplementing their data sets. 100%. They need to be supplementing their member profiles with something that actually engages those people. And it's more for them than just this one thing. There's so many opportunities. They're plugging it into an ecosystem that will benefit them for the lifetime going forward.
Well, it's a supplement to make your data healthy.
Yeah, it cleans it up.
Yes.
It's like you go into a restaurant, easy example. You want to know where the food was sourced from, right?
Yes.
Don't you want to know where the data is sourced from?
Yes.
Don't you want to know that the cow that's been slaughtered maybe had choice in the process? I mean, I would.
Well, I mean, that's why you go to a nice restaurant. You know that chef. You built
Yes.
a relationship with them. You know they go to the market every morning. You know the farmers that they're talking with. They're sharing that with you when you have a conversation with
The chef is
yeah.
the organization.
Yes.
Build the relationship with your members.
But
Have them look
I
at
want to
you.
enjoy the meal, but not take the time to do all that sourcing.
We'll
And it's
handle
the same
that
with Tartle.
Yeah, we can handle that for you.
Yes.
We bring people into the fold.
Right.
They have full control over this process.
Yeah, and that leads me to, and that's why I was using the chef as an example with the burden. You know, most chefs work what? I don't want to
ridiculous hours.
12, 15, 18, 20 hours a day,
Ridiculous
whatever.
hours.
They're taking on the burden.
Yeah.
To make sure that experience is wonderful.
Mm-hmm.
To make sure that every person that comes in and sits down at a table, that from the minute they sit down, from the minute they walk into the door, to have that amazing meal. And we've had amazing meals. We've shared amazing meals together. And there's nothing, it's evolutionary. You know, there's something amazing about having an awesome meal.
Right.
And when it's done right and there's excellence done with it, it creates an experience that is so uplifting. And I don't see sitting there, I'm just enjoying the benefits, but I don't see the burdens.
Correct.
You see what I'm saying?
And that's how it should feel for the member.
Right.
And that's how it should feel for the restaurant or the chef itself. Right. Or the insurer.
Yes. And Tartle reduces the burden.
Yeah. And this is the best part. You get to identify ahead of time.
Right.
You get to capture at the point of capture, maybe when they're in the hospital too. And after the fact, any sort of success metrics on how you actually delivered the outcomes.
Right.
Talk about a quantifiable study so you can really understand cost savings and drive resource to those who truly need it. Don't guess. Don't have this random room of all this data that's being captured. Go about a process where the people you're trying to serve are directly involved. And now you're doing something special. And that's a function of this product that is delivered specifically through the Tartle Marketplace, is one that's not found anywhere else. So if you're looking for those insights from the members, if you're looking for high levels of engagement, if you're looking to understand the metrics of the care you have given, if you're looking to drive 15 to 25% cost savings for early identification, you do that by engaging your members directly through the Tartle Marketplace using that medical product.
I love that. And I want to get a little bit more specific, just for a few more minutes on, because I hear this a lot, and you've heard this too, when we have these conversations in the healthcare industry, is, well, I can go to have a survey company do that, or, you know, we have a department internally that handles that. You know, our marketing does that, so forth, so forth. You know, we have member relations teams, you know, that are put into place that make sure that we have this percentage of, and you know, they have all these KPIs that are all set up for members. And it's like, all I'm doing is just hiring another company to handle this for me. And that's not, so I think a lot of people don't understand the difference in how unique Tartle is. And those are all buzzwords, so I don't want to go there. I want to say it this way. Whenever I can go right now to a steakhouse, and you're vegan, so, but I mean, I can go right now to a steakhouse and pay $18 and get an okay steak. It's corn fed, you know, I mean, the typical. I can go here to Santa Fe and go to I'm not going to name the name, but go to a steakhouse here and pay $70, but have an amazing experience.
Right. And
a unique experience that's only related to that specific restaurant.
Yes.
And it's a very bespoke. It's catered exactly to me.
Yeah.
And there's a reason for that. Two different total experiences.
Because every insurer, every research hospital, every hospital network has different needs.
Yes, 100%.
They have their own measures of success for themselves.
Yes.
So those should be matched. So you'll have your measures of success in a bespoke process, and your member engagement is totally bespoke. This is not us coming in and determining what's best for you and your network and your members.
Yeah, you know, I always tell people this with Tartle is the last thing you need is another dashboard.
That's the last thing you need. And we're not that. We're not here to drive you.
We're not here to take your data, make it pretty and fancy.
No.
We're not. I'm from the South, so we used to say throw pig on a lip, you know, throw lipstick on a pig.
Yeah,
that's not what we're doing with your data.
We're trying to give you something you did not have before.
Yes, there we go.
And we're trying to give it to you in the most efficient, ethical, and, you know, fairly balanced process with your respective members. And
we are a boutique, very exclusive farm and table restaurant.
yeah, but we do it for the data, and we do it specifically for the medical industry.
Yes.
To help them capture that and engage their members, which they are failing currently to do.
Yes. So when they look, a lot of value-based core models, that's talked about a lot, like value-based.
Mm-hmm.
And you get into, it's like, oh, okay, you guys are talking about something that seems very, very expensive. Now you're comparing yourself to Michelin star restaurants and, exclusive chefs and stuff like this.
Sure.
So we're looking literally, we may be coming into recession. We don't know, but we're looking literally as a healthcare industry in value-based data collection.
Why? Because you get a 15 to 25% cost savings. Use 5% of that cost savings, okay, and channel that towards paying your members for that information. 5%. If you're saving 25%, you still have a 20% savings, and 5% of that went to economically uplift your members with this financial incentive to get information you need to continue those cost savings into the future.
Also,
any good
and I know we only look from quarter to quarter.
Yeah, I know.
But the LTV of having continual relationship, a relationship with your member month after month after month, year after year after year.
Where are you going to find that? You're not going to find it on my chart.
Yes.
You're going to do it here at TARTLE.
Yes.
And you're going to drive those cost savings through that identification and engagement and service metrics in the most seamless process you've had in a long time.
Yeah. And I think, the cost savings in data collection, I can go online and buy whatever data I want. And I can have gigabytes of data sent to me. But is that a cost saving? Especially let's say I'm taking it to my machine learning model.
Mm-hmm.
And the information's not even close to being accurate.
Correct.
Well, what have I just done?
You just spent all this money buying, aggregating this data, and then paying another company on the outside to feed your model.
Yes.
What have you learned? Nothing.
Right.
You've just bought more stuff that's not doing anything for you. Why? Because you didn't make the members part of the process.
Yeah, so when we look at, and I think this is really, really important when we're talking about data collection, it is a data collection that evolves.
Right.
That's an important word.
This is not static. When we talk about lifetime value, great. I'm glad I've collected a base idea of the social determinants of your health. Now I want to go deeper.
Mm-hmm.
Can we talk about behavioral health? Can we talk about your mental states? Let's talk about depression. Let's talk about loneliness.
I like that. Yes.
Engage once and then re-engage forever using the platform.
Yes.
That's the point here. That's what this product can do. And you'll find these things. You'll find insights that you didn't even know existed. You'll realize that this engagement will shock you. Stop paying out so many salaries for people to manage all these very inefficient processes. Go to one thing and directly pay those people that you want to benefit.
Yeah, and I know this is a new model, and it's something, and that's why I'm wanting them to be patient, to understand this, and that's why I think that's why this is so important in having these podcasts, because we can take the time to go through it and explain it.
Yeah,
I think another one is member incentives.
Sure. So listen, this is a total ecosystem that the member gets to plug into. This member has the ability to share their earnings that can get through their data sharing. They can put it towards a not-for-profit, maybe a charity that they care about.
Right.
Interesting incentive. Or maybe the fact that they're sharing their data, it's going to decrease the cost of their insurance premiums. The savings to you as a network, 15 to 25%. Drive some of those savings then back to those individuals. If now they're less of a risk because you've had that identification and you can get an early capture, essentially early intervention before the sickness occurs, decrease their insurance premiums. Talk about health equity. Now everybody can really benefit. The data itself is actually subsidizing the cost through the sharing. What an incentive for a member to be a part of that.
Yes.
Who wouldn't do it? Who wouldn't do that? And that's all possible right here through the product.
Yeah, and I think whenever we look at, and I want people to understand the scope of the incentive of working with TARTLE. How many data assets do we have now?
So we have over
health-wise.
Yeah, in the health stance, we have over 70 unique data assets. Within those assets, they can have upwards of hundreds of elements in the inside. They can be huge. They can be gigabytes of information if need be. So you're talking millions and millions of data points just in the healthcare.
So I'm a hospital in Dallas, Fort Worth area, and I'm looking at understanding social determinants of health in some of the certain regions of Dallas-Fort Worth area.
Sure.
Does TARTLE have that ability to be in Dallas-Fort Worth, for instance?
Yeah, we're in every state in the United States. You have the ability to then to drive this sort of data collection and engagement to members and non-members alike. Both things are possible. Maybe people in other member networks. Interesting. Why are you a part of this network? Was it your only choice? Why do you choose not to be a part of the network? Very interesting insights for executive teams and people trying to go out there and give coverage to those that truly need it.
Yeah, 100%.
So when you have access across 50 states to deliver this to people that, and every single one of them has a cell phone of some sort of format, new or old, you can still collect it from them, or if they have an iPad or any other way to access the internet, they can all be a part of TARTLE.
Yeah, laptop, desktop, doesn't matter.
Doesn't matter, right? And so the key here is that when you look at this new way of engaging, quantifying this patient story, or not even patient, quantifying the member story, right? Because you don't want them to be patient. You want to keep them healthy. That's your goal.
Yeah, and in closing, because I think this is something that if you're in the healthcare industry, this will kind of give you that positive aspect of it, and that is like, what are the benefits? Like, and we have a list, and I have them right in front of me, and I kind of want to go over each one with you.
Let's do that.
And we're gonna do like I think this will be fun. Like one of those quick. It has to be 10 seconds or less.
Got it.
Per each one.
Let's do it. Let's go. Rapid fire.
Yeah, here we go. Rapid fire. You ready?
Rapid fire.
Key benefit number 1 for working with TARTLE in the healthcare industry: record of exchange.
Fantastic. You are going to know date, timestamp that this data was actually shared from this party and was shared to this party on this specific set of timestamps here on our internal blockchain on the system. Go. Next.
Second is first party source data.
Great. You are going to the person that you're actually trying to identify and opening up the narrative with them. Next. Go.
Third is comprehensive SDOH narrative.
Great. If I want to know the whole narrative and I want to, in an iterative process, understand this person inside and out, I'm going to study them in one format and then keep going back and restudying them over many different data packets. Next.
Number 4, lifetime cohorts and retargeting.
Beautiful. Again, that plays into the comprehensive SDOH narrative, lifetime cohorts. After these people are already a part of the TARTLE marketplace, this ecosystem itself, I can come back to them. I can even reach people that haven't been a part of my system and target them and retarget them once I found out something specific about their cohort. Next.
Number 5.
Yes.
Integrated directly into enterprise CRM.
So good. We have the ability to object map any of this data directly into your system. So it's light work. Once the data is collected, boom, it's right there in the profile. So the systems you're using as a hospital will integrate right with it.
Number 6, enhanced patient profiles.
So good. Don't you want this robust profile? The robust profile allows you to have that machine learning and that early identification to drive those cost savings of 15 to 25%. Next. Thank you.
Number 7, end-to-end patient visibility.
How cool. I can look at the entire lifetime. I can look at before they come to the hospital, when they're at the hospital, and when they leave. Thank you.
Number 8, health equity focused.
Oh my gosh. I'm actually properly incentivizing groups, even groups that have been missed, to participate in the aspect of this data sharing. What's more what has more equity in that process than actually engaging them in that format?
Number 9, early patient identification and intervention.
Yeah, absolutely. So I can go about TARTLE before this person even comes into the hospital, and I can identify certain aspects that are going on in their own behavioral, mental, or social determinants to say that, hey, can we drive some resources towards you? Would you like to talk to an advisor about this? Let's have a conversation.
So we hear this word, and we'll close in this, and I want you to talk to this. We hear this word, conscious capitalism. We hear that a lot, especially here in the United States.
Yeah.
Why is it good? I'm talking like good, like heart-wise, good for a healthcare company to partner up with TARTLE? Like for humanity, for themselves, like why is it like that inherent good inside of you?
For so long, much of society has looked at healthcare systems and insurance that they're out to get people. They're out to bill them through the hilt. It's a cultural thing. Ask people. Nobody wants to deal with insurance. Nobody wants to go to the hospital. No one enjoys that. And so when you take this stance that we are going to use someone independent of our system to come and engage with you, have this conversation, meet you where you are as a human being, you're doing some real good here. Now you're saying, I want to be with you at your level, at your home, having this discussion. I really want to understand who you are as a human being because I want to deliver what's best for you. I don't want to bill you. I don't want you to get sick. Use this product to tell the narrative that you are here for them. Walk the walk and talk the talk. And this product allows you to do that. That's why the engagement is so high. That's why it's designed for these incentives. That's why the amount of data that can be captured is so remarkable, because you're doing real, wholesome good. It's no longer about the dollar value first. It's about the human value. That's what the conscious capitalism is. You're trying to run an efficient business as a hospital or as an insurance group. We don't want you to fail. The public doesn't want that because we need insurance. But we do want it to be in the best interest of the public, because that's what the public needs. And that view, the optics around it have to change. Show us that you are really a part of health equity. Show me that you really care. Show me that you really, truly want to engage with me. And let's do that over a long time. Let's build a relationship. And that's what conscious capitalism is doing now. It's about building relationships with those people at the end product or service.
So tartle.co/buyers.
Mm-hmm.
And you can schedule a meeting. We'd be
Anytime.
more than happy to talk with you and have this conversation specifically for your needs and wants or whatever you have related to data.
And we're available 24/7, and we'd love to talk to you about it. Thank you very much, everybody, for joining us here today on TCAST to talk about the TARTLE Social Determinants of Health data capture product that we have in place and the benefit for the medical and insurance industry itself. Jason? Thank you.